I'm going to start that again since I was on mute. Hello and welcome to the NYU Returns webinar on returning to work for adjunct faculty. Please note that closed captioning is available for this session. My name is Charlton McElwain, and I'm the Vice Provost for Faculty Engagement and Development, as well as Professor in the Department of Media, Culture, and Communication at Steinhardt. With me today are Rich Baum, Chief of Staff to the President, Carlo Ciotoli, Associate Vice President of NYU Student Health and Executive Director of the Student Health Center, Sibel Raver, Deputy Provost, Clay Shirky, Vice Provost for Educational Technologies, and Matthew Driscoll, Assistant Vice President, Employee Relations. Thank you all for joining us this morning. I want to remind our viewers that we'll be starting off with a presentation followed by some questions that were submitted in advance. We will also be taking questions from the audience. If you have a question, please click the Q&A button. We'd like to remind you that we will only be answering questions today about returning to work for adjunct faculty. So if anyone has a question that would be better answered in a future webinar session, please know that we will pass those questions along to those panelists. All right, so let's get started. We're going to begin with a presentation on returning to work with Rich Baum. Rich?
Thank you, Charlton. So as Charlton said, I'm Chief of Staff to NYU's President, and I'm one of the people coordinating the NYU Returns effort. And we really want to get to your questions, but we thought it would be useful to just do a short kind of 5-minute baseline of how we're thinking about this this project and all this work so far. Before even getting into the details, just wanted to say that this doesn't work, or this isn't meant to be a project where we all sit in a room and come out and say, here's how we're doing it. It only works in an iterative way. There are just too many moving parts and too many details, and there's no way to get it right with a small group of people. So consultation, talking to you, hearing your thoughts is really key to making this work. We had an idea scale project, which you probably heard about, allowing people to give direct ideas and input. But in this meeting, after this meeting, let us know. We really want to understand what works and what doesn't. So let me just go ahead and give you just some short slides here. Go to the next one, please. So we all hear and read so much about what should be done in the current situation. With that in mind, I just like starting this pointing to the 3 main sources we look to right now. The first one, the most famous, probably most familiar to you, is the Center for Disease Control. Obviously, not exactly the Center of Disease Control we were all used to in past years, but still, this thing just popped out on my screen, but still a source of important medical guidance throughout the country. And when CDC issues recommendations or guidance, it does ripple throughout the country and certainly to higher ed. The most famous example is at the beginning of COVID, CDC was very focused on physical touching, and then based on medical evidence, switched to masks. But more specifically, they came out with guidance on higher ed, which we looked to and was informative to us. The other I'd suggest is the Commission on Independent Colleges and Universities. On the left-hand side, you might not be familiar with this. It's our professional association in New York State for NYU and all the other colleges and universities. They're our main interface with the state, and they try and both represent our concerns to the state and also bring back information. But as importantly for the purposes here, they're just an amazing way for us to kind of crowdsource how we're dealing with all this. Getting on the phone with all the other colleges and universities allows us to test our thinking, to hear what others are doing, to evolve our thinking in response to what others are experiencing. It's really been an important and major part of figuring out how to proceed. And on the right-hand side is New York State government, which by which I mean New York State has exerted tremendous control over day-to-day life since the COVID crisis began, and that still is ongoing. We all experienced the pause and then moving through the 4 phases of reopening. And New York State certainly has the ability to move backwards in that. Specifically to higher ed, they came out with guidance about a month ago that included both recommendations and what amounted to mandates. And that document is really the bedrock of how we're proceeding. In some cases, we're doing things more. In some cases, we modify what they propose to the NYU's unique situation in an urban compact environment. But our view is they did a good job of assessing the best medical evidence, and moreover, a lot of it's required, whatever we think of it. We are required to submit to the state a filing in early August, essentially, basically this week, of our response to their guidance, how we are reacting to it in NYU. And if you could go to the next slide, please. That filing will probably be sent today or tomorrow. It'll be posted on our website. And it's divided into 4 areas: our reopening plans, our monitoring plans, our containment plans, and our shutdown plans. And shutdown, I think, would be a bit of a misnomer to us, because even in pretty extreme circumstances, what we would be doing would be switching to online instruction, not simply shutting down. I mean, major parts could shut down, but not instruction completely. But anyway, this filing is being completed, will be sent in. It does not need to be approved. We just simply must let the state know how we are responding to their guidance. Next slide, please. So when we started this project of reconfiguring the campus and NYU for the current situation, President Hamilton, Provost Fleming, those of us on this call, other stakeholders in the community sort of tried to gather what the guiding principles would be. And, you know, I've found these are important because in working this project, it's very easy to get caught up in the mechanics, how the HVAC will work, how the cleaning works, details of classroom instruction, all incredibly important, but it's easy to lose sight of sort of what's your orientation, and, you know, how are you thinking, through what lens are you deciding upon those details? So I just want to call these out quickly. I'll do the first one in the next slide, actually, which is the idea of having not just one intervention to make the community safe, but several, but I'll come back to that. The next one is maintain the highest possible standards of teaching and research, by which we mean just because the situation is suboptimal, we don't want to accept whatever is passable for teaching and research. We want to aspire to the best it can be. And obviously, the best it can be if we return to the way things were before this all occurred. But in this situation, we want teaching and research to be at the standard that we expect of NYU. To that point, in the next bullet, we're using multiple modes of teaching, learning, research, and working. In other words, to provide the best experience for everybody, we're looking at in-person, online, mixed, whatever it takes to get the best possible result. The next slide, we've learned we have to respond quickly to the public health landscape. You know, we've seen that we make our plans, and we make a lot of plans, and what we've learned is whatever plans we make, we have to be ready for them to change. And we saw that in the last few weeks when COVID sort of surged in multiple states around the country, and New York State imposed a 2-week quarantine period when coming from those states. And that has dramatically changed how we're handling the arrival of students and what they're going to be doing in student housing. In other words, students from those states will have to quarantine for 2 weeks before classes start. The next one is creating a flexible fall, spring, summer schedule to allow everyone in the community to configure their research, teaching, and learning in a way that works for them over the next year. Second to last, using our global sites as an asset, not a burden. Many students, I'm sure all of you know, this is one of the most international campuses in the country, if not the world. And there are many students who cannot get back here to continue their studies. So we've utilized the global sites as kind of gathering places for them to come together and continue their studies and continue advancing towards their degrees. The last one, advance diversity, equity, inclusion, and belonging, and enhance pathways of success for marginalized and vulnerable members of the community. I think we all have observed, and in the paper and around us, that the impact of COVID has been deeply disparate, and it's incredibly troubling to me, and I think any thinking person. It's very important to us that disparate impact throughout the society not be repeated at NYU. That we don't accept that disparate impact as a given, and in fact, assure that people are not experience this in a way that is disparate and differently impacting them. Also, we want to do what we can to counteract that dynamic in the wider society, although yet we have to accept it's the wider society. We don't always have the ability to change what's not under our control. Next slide. And I should, before we go, actually, next slide, I should say, when this started, some of you might know Lisa Coleman, who's the shorthand name Chief Diversity Officer at NYU. She created a very useful set of guidance for everyone working on the returns project, to sort of help them think through what they're doing and refract it through the lens of diversity, equity, inclusion, and the issues of disparate impact. And as we've all seen in the society, that could be economic, it could be medical, but she's been working, and her team have been working with all the work streams to make sure that the details of what we're doing do not differently impact different communities. Next slide, please. These are those work streams. I just put this up here to show how we're thinking of it. These are the 6 areas. When we make our lists of what needs to be addressed and done, we really put everything into these 6 areas just to make sure it's clear who is dealing with it and what teams are dealing with it. Next slide, please. So this is where we are now. As I'm sure you know, masks on the left, teleworking in the middle, and social distancing on the right. But this is really, this is where we were during the summer, but it gets much more complicated during the school year. If you could go to the next slide, what I referred to earlier, the layers of safety. What I've learned in this whole project enterprise is that anyone who tells you there's one solution is basically wrong. Any one solution won't be enough to make our community safe. It's a number of solutions that each one play a role in reducing the risk, and altogether they reduce the risk to an acceptable level. So just to mention them, testing, we're all familiar with that. Tracing means following up on when there's an incident of COVID, to who that person's been in touch with. Quarantine, I mentioned before, is self-explanatory, and we've reserved about 5% of our housing capacity for quarantine space, which is the guidance we received from best practices from the government. Face coverings, all familiar with that. Physical distancing, daily screening, meaning that anyone coming into NYU building will have to do a daily screening on their iPhone, likely on their iPhone, about possible symptoms, density, and cleaning. And Dr. Ciatoli will come back to some of these in a few minutes. Next slide, please. So this is my last slide. You'll be seeing a lot of this around campus and online. This is the kind of look of the whole COVID response, and it's an effort to set a baseline in the community of how people need to act. And one of the mistakes in American society is really from the top, is that this was presented as simply something you can decide to do for yourself. In other words, protect yourself against COVID. And I think what's lost is the idea that this is about other people too, and a community. And so this keep each other safe is meant to repeatedly suggest to people that this is not just about themselves, it is about others. And this is particularly important dealing with the young population that I think we've seen around the country, sometimes feels invulnerable, sometimes isn't responsible. And it's meant to remind them that this is about their friends, their professors, the people who work on campus, the wider NYU community. And you'll see this really everywhere around campus when you're here, to the extent you're here. So with that, I want to pass it off to Dr. Ciatoli, who's going to talk more about public health. And there were a lot of questions about this before this webinar. So he'll sort of weave those responses to those, I think, into what he's talking about, and then take more questions.
Great, thank you, Rich. And we can go to the next slide as well. And thank you for the opportunity to speak to you all and answer some questions. And thank you for submitting the questions. During the introductions, I was introduced as the AVP for Student Health, true, but really since the spring have been serving in the role of leading the university's COVID prevention and response team, knowing that we really need to engage and think about policies and process for the entire university community if we're going to make things as safe as possible. Rich showed the slide of our communications campaign, that public health campaign that I think is so critical to success. It really reiterates those behaviors, those public health best practices that we know are foundational to keeping transmission rates very low. It's what really allowed New York State to go from a point of being the epicenter of the pandemic to where we are now, one of the few states with very low rates of disease and very low transmission rates, and having kept them there. And those are things that we have control over. They're behaviors that if we adhere to will put us in good shape. And that includes consistently wearing a mask, making sure that we physically distance when we're supposed to, avoiding large gatherings, washing your hands frequently, staying home if you do get sick. All of those have been successful in reducing transmission rates. And again, are things that we fully have in our control and I think are critical, and again, make the importance of that campaign really a top priority. Social distancing, we have addressed in a whole host of ways, again, knowing the importance of it. That is everything from de-densifying the classrooms in terms of the number of students in a class to broad occupancy guidelines so that the number of people in a particular space is reduced, including elevators, to ingress and egress signage to, again, facilitate people being able to socially distance, have all been planned for and implemented as we head into the fall semester. We also have some specific health interventions, again, aligned with some of the guidance that the state has given us, and Rich alluded to one, which is what we call the daily screener. So each day, if you're coming in, you are to report back if you've had any symptoms that might be COVID related. If you've had a temperature, actually taking your temperature that morning before you come in to see if you have a fever. Letting us know if you've had any contact with someone who's got a confirmed or suspected case of COVID, or if you yourself were told you have or may have COVID as well. And one of the questions that came up that I think is a good one, we all know that the symptoms of COVID are very nonspecific. Many things can cause the same symptoms that COVID causes. So what do you do if you're filling it out, but you think that it's just related to some chronic condition you have, or you're pretty sure it's from something else? And the short answer is you answer honestly. You acknowledge that you have those symptoms, and a member of our COVID prevention and response team will follow up with you and will assess whether they think there is need to pursue testing for COVID, or is there another clear rationale for it, and again, appropriately intervene and act on that. Testing, we certainly get a whole host of questions around testing. I think that the email went out last week, which hopefully provided some background and context for that. So I will go over a couple of aspects of testing just to reiterate and answer, I think, some other questions that have come up. One, when we talk about testing, we are talking about viral PCR testing. So this is not antibody testing we're talking about. And for employees, for faculty, for our adjunct faculty, the requirement for entry testing would be to get tested 14 days before the first time you are anticipating being in an NYU building. Now, if for whatever reason you have already been coming, your department gave you permission to come before the 15th, then we expect you to be tested in a window between August 1st and August 14th, have the results back and submitted before the 15th. But if you're really looking towards the start of the semester, it is 14 days before the first time you are anticipated to be in an NYU building. We have provided multiple options for that, with NYU Langone being one of them. It's not the only option. Langone has multiple testing sites throughout the 5 boroughs and on Long Island out of Winthrop Hospital. But those are not the only places that one can go. Urgent care centers, pharmacies are offering testing. The advantage of Langone is that the turnaround time has generally been about a day. Depending on where you are, it may be longer. So I think you just simply need to build that into your planning in terms of when you are coming back. Again, most of the other labs, not quite as fast as Langone, but still not as bad as I think we've seen reported in other parts of the country. We are asking that those test results get submitted to us. There is a specific link, which was included, that follows all privacy and confidentiality requirements. Only the COVID prevention and response team has access to that data. So we are very conscious of the confidentiality and privacy aspects of the health information. So that's entry testing, that initial test. Throughout the semester, we plan to randomly test the entire community as part of our surveillance testing. And that will be done testing a certain percent of the population weekly to both pick up any individuals who might have asymptomatic cases where you're not feeling the symptoms of COVID infection, and to be able to track how many cases we have week by week on campus, which will allow us to know if we can be a little less restrictive, open up a little bit more as the semester goes on, or do we need to become more restrictive on certain things if case counts begin to go up throughout the course of the semester. As an individual, people have asked, like, so does that mean I'll be tested every 14 days? Probably not. You might get tested a couple of times throughout the semester. In part, it will depend on prevalence of disease, and it will depend in part on just overall capacity that we have for testing. But again, everyone should be expected to be tested probably again after the entry testing at some point during the semester. And then finally, we will have certainly the opportunity for people who are symptomatic, whether it is done at the Student Health Center or a site that we determine for symptomatic testing, including referrals out into the community if people need to get tested because they are symptomatic or are a contact of someone who is a confirmed case. People have also asked, will we know if someone tests positive? So the short answer there is only as part of contact tracing. So I will touch on that a bit, which is the fact that once we identify an individual who is positive, a key component to mitigating further spread is fairly expeditious contact tracing. That is, who was a close contact. And the definition of a close contact, depending on whose definition you use, is being within 6 feet of someone for a period of time of generally at least 10 to 15 minutes. And generally that's without even any type of PPE. We will have our own contact tracing team here as part of our COVID prevention and response team that will work in collaboration, in conjunction with the city's test and trace program as well, so that we're ensuring that we have good wraparound of our contact tracing should there be cases, for example, that are outside the community, but that might involve our community members. We'd rely on the city for that, but also knowing that we are in and of the city, we might have a positive case where people have been in, local merchants or wherever, and that we want to let the city know that so they can reach out to those who are not part of our community as well. The question has come up in a couple of situations. If a student tests positive in a class, is that an automatic reversion to remote teaching then? Does the entire class need to be quarantined? And the short answer is no, it is not an automatic. We would do the contact tracing assessment, evaluate, and then come to a decision who, if anyone in the class, does need to be quarantined. There could be a situation where it was everyone. It seems unlikely if we are following the other guidance that we've laid out about wearing masks, facial coverings, and distancing. But again, that would be a case-by-case analysis of the situation. We certainly will continue to track various metrics, both at the state level, the city level, and our own NYU metrics, some of which I alluded to, case counts, how many contacts per case, and various other metrics to see where we are, which again will guide us as we go through the semester about whether we can be more or less restrictive. And then finally, just thinking about how we deliver services to our students, knowing that some of them will be taking classes fully remotely, not in New York, and thinking through how we still provide support for that group, while also thinking about how we provide support and health and mental health services to the students who are here in a way that is safe for the students, safe for our health center staff, and safe for other members of the community who might be in the same building we're in, where there might be concerns around healthcare delivery for students who might be sick. So again, being very conscious of all of those in terms of how we redesign service delivery. So I am going to stop and turn it back over to you, Rich, I guess.
I think I should go to Charlton if there are any questions.
Indeed. So thank you, Carlo. Thank you, Rich, for that presentation. And we'll go right into a number of questions that have not been covered already. And maybe we'll start with this first one. Carlo, you said a little bit about sort of the testing protocols for folks who are both in the city, but also in the tri-state area, those coming from outside of the tri-state. Can you say a little bit more about what testing looks like for those groups of people, and also about how do people submit testing results when they get them from the varying places that they may go?
Sorry about that. Testing requirements for the faculty and staff are a little bit more streamlined than for students. It is really dictated by that August 15th date. So for anyone who has already been coming in, either they were deemed as part of our essential personnel group or departmentally they were given permission to come in. For example, our researchers have been coming in since early June. So for that group who is due back or has been here before the 15th, the expectation is that people get tested between August 1st and August 14th with a negative result back and submitted by the 14th. And there is a link in the document for the form for the submission, for the upload of the result. So people should see that in that email, and we'll continue to put it on the website, push it out through our various communications, but there is a discrete link for document submission, for test result submission. So that should be available, again, in the email that went out. And then again, in terms of testing, we know that not everyone lives, close enough to a Langone site, and that it simply may be easier to get tested locally, where capacity generally has not been a huge problem. There might be small pockets. I think people just need to be cognizant of the turnaround time to ensure that it gets done. And again, anyone coming on the 15th or after would need to get tested simply 14 days before the first day they anticipate being back on campus in an NYU building.
Great, thank you. Next, a couple of questions about the classroom environment, and so maybe for Clay and perhaps Sibel. So the first one is about audio enhancements. What are we providing in terms of mics, et cetera, to help faculty and students with hearing abilities, and for those students who need to read lips, et cetera?
Right. So for audio enhancements, some rooms are being enhanced with physical hardware. Some rooms are being enhanced with essentially roll-in carts. We're calling them Zoom carts, in part because NYU has such a large and diverse classroom stock, and in some cases, specialty classrooms. There isn't a one-size-fits-all solution, but we are increasing essentially screens, microphones, cameras, speakers, as you would expect. Your school is, for anyone wondering what their particular classroom will be like, your school is the one that maintains the classroom stock. As August goes along, we will know which rooms have which kinds of hardware upgrades. For questions about lip reading in particular, there is a stock of masks with clear centers. It is not unlimited. So for classrooms, for faculty or students who need that, you should go to the Moses Center and request that as an accommodation for teaching.
Great, and maybe if we flip to the other side about students, what access do our students have to laptops, other hardware, software that they may need, particularly for students who may not be able to afford them and more.
Right, right. So we did that ad hoc in the spring during the March conversion. We just bought several hundred Chromebooks and distributed them to students as they were dispersing, and then continued to field requests. We've standardized that process somewhat. There is now a COVID-19 emergency relief fund, and I think we're going to paste the URL in the chat. But students who have real need for help with connectivity or hardware to attend class, do their assignments on, and have no way of getting that on their own can appeal to the COVID-19 Emergency Release Fund. In the case where faculty have a similar set of issues, who will be operating in a home or work environment away from campus that isn't well set up for that, you would work through your local IT department, and then if your school needs to work with central IT, those requests will come from the schools. But faculty should contact the IT department in their schools first.
Great. Out to a more broad question. There was a question came in about our benchmarking with other universities, particularly large urban universities. So what can folks tell us about what we're doing and our protocols in comparison with similarly situated institutions? Maybe Carlo or Rich, if you want to.
Carlo?
Yep, sure, I can start. So I will say, at least for New York State, we're all adhering to the guidelines that the state put out. So I think generally, and I've been in contact with many of my counterparts at some of the other larger institutions in New York, as well as outside of New York. And I would say certainly each school, has their own nuanced approach to certain aspects of it. But as a general rule of thumb, I think that we are pretty aligned with what most of the other major large universities are doing, again, particularly in New York State, because we're generally all adhering to the same guidelines. And again, I think, at least for my counterparts, there's been a lot of sharing of, here's what we're doing, and here's how we're going about doing it, because all of us, I think, are obviously trying to do the best for our campuses, but generally aligned in terms of interventions.
And as I mentioned at the beginning, we're on these calls with the CICU, our professional association, and we hear what everyone's doing, and we share what institutions are doing. It's not a competitive environment. It's actually a really great sharing environment. And even outside of New York, I personally, and Carlo, sort of in the medical area, we closely monitor what other major institutions are doing around the country.
Great. Thank you. I wanted to just make a mention and recognize that we've got a number of questions coming in about options, and just wanted to mention that information about how to request accommodations for adjuncts is forthcoming. So you'll be seeing that shortly. So all of the testing protocols that we have, all of the instructions about how to keep folks safe. What are we doing to ensure that students, instructors, staff, others across the NYU community are complying with these mandates? And what are instructors' role in terms of reporting folks that are not being compliant?
I can speak to that. On the issue of compliance, there's really, at least I think of it in two parts. One is baseline setting, and the other one is compliance. And, from all the public health literature, both are important, but the baseline setting is really, really important. In other words, you're not going to get a cop on every corner, and we don't want a cop on every corner. You need people to feel like these rules are what they need to do and what the community expects them to do, and sort of almost to feel it's embarrassing not to comply. And, one example is the huge social shift that took place around smoking in the last decade or so. To that end, the communications office is going to be mounting a really large-scale communications effort directed at everybody, but I think really highly directed at students on social media, on posters, on email, just any way we could reach them. Also, we're creating a core of This is actually a best practice we learned from around the country of student health ambassadors, whose a considerable number of students will be visible in most high traffic areas, who will be clearly marked and there with masks and hand sanitizer, brochures, encouraging students to follow the rules. And what we learn from others is that, especially with this age group, peer pressure is one of the primary motivating forces. Obviously, there's another part to that around compliance. So just to call out a few parts of that. One is the campus code of conduct has been changed to reflect the social distancing rule, masks, all the major things we've been talking about here. Not going into too much detail, we intend to enforce those rules. They're not suggestions, and non-compliance will be taken very seriously, and I think the students will recognize that quickly. And the specific question here is about what an instructor should do about non-compliance. There are several routes. Obviously, you have to decide for yourself what you feel comfortable doing. We do not expect instructors to be the enforcers. That is the Office of Student Conduct and Student Affairs. If you spot something or something is going on, one option is to refer the student to the Dean of Students in that school, who will then bring it to the Office of Student Conduct and will reach out immediately to the student. Two, the Student Success Platform, NYU Connect, which is usually used to help monitor students' grades and their performance, will now have a way to flag a COVID discipline problem, and that will immediately go to the Office of Student Conduct, who will again immediately reach out to the student and bring them in. If there's an on-the-spot problem, there'll be an individual from a student affairs professional, basically someone from the student affairs office, on call in the three main areas of the university: Brooklyn, Washington Square, and the Health Corridor. And that will be providing information of how to reach that person, or reach kind of the desk that reaches that person. And that person will be able to show up, I'd say 5 to 10 minutes any place, depending on the location. And those are student affairs professionals. They're trained in de-escalation, managing rambunctious students, managing problems, and they're closely connected to the Office of Student Conduct too. So, I think all of these different strategies interlock to allow both encouragement and enforcement. There will be incidents. There will also be instances of students just doing something silly or foolish or erroneous that can be corrected. But of course, we always have to expect people are just non-conforming, and we're gonna deal with that quite seriously.
Great, thank you. Carlo, can you say a bit about specific masks? There's the question, will there be some instruction to instructors, students, etc., about, are there particular masks that are best used, others that we should not be? Will we be communicating that?
Yeah, so we have provided that guidance on the website, and I think I'm glad that someone raised the question. It's a very good question, a legitimate one, as we've learned more throughout the last couple of months. But we do have current information up on the website about the masks, but we will make sure to go back and continue to update it so that everyone's got the most up-to-date, accurate information. I think lately there's been some concern about masks that have one-way valves in them, which actually allows air to go out, which is not what we want. So again, sort of important distinctions about which are appropriate, allowable, which ones are not, and really what our policy is around masks. So we will make sure that's all up to date, but there is a site, a page on the website that does address this.
Great. Thanks. So back to the classroom a bit. We know that students will be, doing classes in person, some remote. We have students that are international, so on and so forth. Bill, what is the protocol for recording material for instructors? And then a flip side of that question is, what are the best practices in terms of letting students know about classes being recorded and material being recorded, and maybe even for the environment, whether it's Zoom or the LMS, what are the best practices simply for maintaining privacy as we are recording for classroom material?
Did you say Isabel Charlton?
I
That's for Claire.
started to answer while forgetting to unmute. Sorry. Speaking of recording, the trade-offs around recording are, of course, complicated, and because it has to do with classroom conduct, is presided over by the faculty member and worked out class by class. But the basic principles are these. If you are recording material that the other students have heard live, you do not need student permission, provided it is only shared with that group of students effectively as notes for the class. I should say whether the student heard it live or could have heard it live if they were attending. Two principal reasons for recording a class in that manner would be to provide notes for the students to review afterwards, and to provide access to students who may be in time zones where live sessions are difficult to attend. NYU's three largest source countries for international students: India, South Korea, and China, which are 9.5, 12, and 13 hours away. So in many cases, afternoon and evening classes will not be able to be regularly attended by those students. Recording is obviously the answer there. We caution faculty against doing anything with the recordings other than making them available to their students. If there is some reason you would want to share them more broadly, then yes, you should get student permission before you use the recordings in any way outside of the classroom, and that we ask that you respect student desire, student interest in keeping their camera off if that's their preference. Many of them will be attending from home or attending in environments that they can't control, or may not want to show to their classmates or to their faculty member. And we ask that you allow audio attendance where there are live class sessions.
Great. I think this next couple of bundled sets of questions for Carlo and maybe Rich, and that has to do with facilities. And so one is, what are we doing in terms of HVAC and ventilation for safety, and then facility maintenance? Is there a regular schedule for places like laboratories, libraries, sitting areas, et cetera, to be cleaned, et cetera?
Why don't you do the air quality, Carlo, and then I'll do the cleaning.
So I know that, and I don't want to speak for Linda Chiarelli from facilities, but she has done a lot of work on looking at how to maximize ventilation in the spaces. The sort of before coming back, all the maintenance work has been done in the ventilation systems, changing out filters and what have you. But the most important thing I think they're trying to do is maximize the amount of fresh air brought into the classrooms. And what we know from the epidemiology, from the data, it's the poorly ventilated spaces that are potentially problematic. So that she and her team has gone throughout campus, building by building, to ensure that they are maximizing ventilation and the amount of fresh air that is being brought into particular spaces to mitigate risk in the transmission of the virus. That being said, I think one of the other things that we just shouldn't forget about is we do have a universal mask wearing policy, so that there should be less virus in the air, which is an important consideration just when we're thinking about collectively all the things that we're doing to try to prevent spread. But it is something that the university has been very conscious about in terms of maximizing ventilation in the buildings.
Just to add on that with the air ventilation, you know, one problem is it's fairly technical, so it's hard for me at least to talk about it in an informed way since I have no technical knowledge. But from talking to them, you know, what I've learned is, you know, air conditioning and air ventilation is different in each institution depending on when a building was built and the kind of equipment that's in there. But they're configuring everything to fit with the standards that have evolved over the nation, which is a certain level of recirculation of outside air. And they have assured themselves, assured me, assured others that the amount of circulation fits in with the standards that have been adopted around the country. On the issue of cleaning protocols, I think if you're on campus, you'll see a dramatically increased level of cleaning around you. There's going to be a continuous refresh and cleaning of most areas, and certainly high traffic areas, elevator buttons, banisters, doorknobs, bathrooms, and there'll be refreshes throughout the days, and there'll be logs kept in those spaces of when they've been cleaned. Additionally, in classrooms, there will be ample cleaning supplies, meaning wipes, hand sanitizer, paper towels, and garbage cans for all of that, to allow people to take their own sort of control over their personal space and make sure it's clean.
Great. Sibel, a couple of questions for you that are somewhat related, and that is, what is the protocol? What will we do if an instructor falls ill? And then in terms of students, both in that situation or other situations, what recourse do students have in terms of from in to remote if they so desire for any given reason?
Sure. I think it's a really important question to think a lot about what happens if each of us, at various points in the semester has to return home because we fall ill or because of, issues of quarantine. I think what we've been trying to message really consistently to all of the heads of programs of study across the university for all 7,000 courses is that everybody needs to be really ready to pivot to be able to provide their instructional content online. That may be for a whole host of reasons, including if the prevalence rates for the city or for the state, for example, go up, and the extent to which we need to plan for what happens if each of us gets sick while teaching. I'll be teaching a big ideas course, for example, is exactly like a flu season during a regular year times, pick your exponent to think about how much more planful you'd like to be and need to be. Certainly talking with the director of your program of study to think about who is going to pinch hit for you if you had to miss a class or two, or alternately what asynchronous material you might have available for your class to be able to view for that week would be really important. And of course, Clay can continue that line of reasoning in addition to sort of the general gist. But really, I think we want to be trying to prepare to be as nimble as possible. For students, obviously, any student who wants to stay in their room or at home or in a location, not the classroom, if they've enrolled in an in-person or hybrid setting, absolutely can do that. They can take the course remotely, and we need to be prepared for them to take that class remotely. If a student wants to take all their classes online and they have signed up for in-person classes, we are reaching out to those students just to say, you might want to take a course that's designed for online offering so that the class is more tailored to that form of instruction. But in the main, overall, we really are going to have to be prepared and have the opportunity to be prepared now for that kind of set of contingencies. It's going to be a very dynamic classroom environment, and that includes issues around assessment. Folks have been asking about what happens if we get close to Thanksgiving. Will we have early closing? We don't plan on that, but again, we really strongly suggest that if you can think about how to assess your students' knowledge and content of the class, not all at the end of the semester and not through high stakes testing, that would make sense pedagogically and from delivery perspective in this very fast changing environment.
Great. A couple of questions. One about the classroom again and its instructors and face masks versus shields. And so the question is really about voice projection and so forth. Can instructors use one versus the other? Or if it's mask only in terms of instructors in the classroom, what could be done in terms of particularly faculty have to teach over long, if it's a 2-hour, 3-hour kind of course.
I'll take the policy aspect of the mask, and then maybe Clay, you can take the technical aspect of what we can do. So we have made it policy that face masks or face coverings are the requirement. If there is a specific medical need for something different, that would go through sort of an OEO accommodation process. But that is the policy that we've set for the university, primarily because that's where the strongest evidence lies in the terms of the use of masks, excuse me, and face coverings. But I would defer to Clay if there are things that we can do to help amplify voice, if that's a concern.
Right, this is essentially a species of the answer I gave earlier, which is to say, because it's the classroom issue, this goes to the schools first. They need help, they will certainly come to us. But if a family member feels that by keeping a mask on, they are too limited in their ability to address the whole class, you may need a microphone that essentially amplifies your voice in the classroom rather than just bridging to meet a remote student. That's a question to bring up either with the academic affairs group or directly with the IT department in the schools. And again, if they need to come to us for help with classrooms or amplification, they will.
Great. Another question, maybe for Sibel and or Clay, and that's really about sort of flexibility around typical student behavior, social distancing in stairwells and elevators that will likely make it, difficult for folks to arrive at their classrooms on time, issues around attendance. Are there protocols or standards for instructors to go by in terms of the flexibility that they provide for some of these normal types of student classroom engagements?
Yeah, I think, we really expect that everyone's going to have to be extraordinarily flexible and extraordinarily gracious, right? It's going to be those moments where you want to indicate to your colleague that it is of concern that he or she is standing too closely and or has their mask pulled slightly below their nose, and how are you going to gently and calmly say, hey, it would really make me more comfortable, and everybody else, if you put that mask back on your face correctly and step away. I think it's that extent to which we're going to have to really generally express a lot of gracious and flexible response to one another. And in the classroom, certainly students are likely to arrive late for those first few weeks of class. Students are also likely to arrive early. We ourselves may have some challenge just getting through the rhythm and the cadence of screening, and we just know that that's going to take some getting used to. Some buildings in some cases are going to be a lot easier than others. Some programs are going largely online, particularly in the graduate space, which will de-densify quite a number of the buildings and the campus in very substantial ways. So, to offset the worry of all of that sort of crowded, high traffic energy of the square, we have the other possible reality, which is that there will actually be fewer people trying to navigate physical space because so many students are taking their classes in blended or hybrid and or online format.
Right, and just to add to Sibel's observation about flexibility, you should make sure students that you expect them to attend class, and if they can't be there in person, that they should attend online. However you have set that up, there will be periods in which people are quarantined because we just think they've been in contact, and contact tracing takes them out of the classroom while testing is going on. So to Sibel's point about flexibility, some of these kinds of issues are not going to be about the first couple of weeks, but are really going to be something that could reoccur during this semester. Again, depending on contact tracing and quarantine protocols. So when you set something like that up, be ready to rely on those kinds of changes of student attendance patterns throughout the semester. And Charlton, there was also a question that came in from Susan Fox. I'd like to take here that was related to the earlier question about Zoom privacy. Someone asked if there were any privacy issues in surveying students about their attendance preferences. We are in fact going to do that for the entire student body. That question is going to be asked via Albert, and faculty members will know in advance of the class starting which students plan to be remote and which students plan to be in person. So there's no need for each of you to do that one at a time.
Perfect. And Sibel, maybe you can give us a little insight. There are a couple of questions from folks about sort of how we arrived at this point. So a little of the big picture, how did we choose which courses were going to be taught remotely, in person, and all of those different permutations?
Sure. It is, I will say it has truly been deeply inspiring to see the level of collective wisdom and intelligence and creativity that has brought us institutionally to this point. We started this process in late spring, where we really were trying to figure out how possibly we could mount all that we can in person while keeping everyone as safe and healthy as possible. And in doing so, we really worked with the deans, and the deans worked with their directors of programs of study, really understanding that we are operating in multiple regulatory environments. We have state authorization for every single degree granting program of study that we couldn't deviate from in terms of how and what we offered. We have the state regulations in terms of health and safety, and then we have what faculty may need to be thinking, all instructors may be needing to think about in terms of their own health, their own safety, their own family members, and other issues that they're dealing with at home. So to kind of manage the really powerful sort of force that is our instructional workforce and the really powerful force that is our student demand, how could we come up with this sort of combined solution? And to do that, we did some very basic, simple strategies. So courses that were 40 students or more, we decided should all go online, or virtually almost all of them go online, because it fit both federal and national organizational guidelines, but also because it just made a ton of sense in terms of keeping 6-foot distancing. We just don't have that many rooms that can accommodate that many students, many more students with that 6-foot guideline. Classes that were 15 to 40, we realized we could have faculty and instructors offer in a hybrid format, basically rotating students through those rooms on a either weekly or tri-weekly basis. And then classes that were 15 or fewer students, we could see our way to finding classroom space that would accommodate those with the 6-foot distancing guidelines. So really, it was a truly Herculean lift on the part of everybody at all levels of the university to come up with this combined strategy.
Excellent. It looks like we are coming up on time, so I have one final question, and then I will ask our panelists if they have any closing thoughts before we wrap. So there's a question about the libraries. Will it be open? Can instructors send students to the libraries for resources? What is a library's capacity during this time?
The library will be open. People can send students there for resources. It will function differently. I think much of the material will be brought to students rather than sending them to the stacks. I think we have a page. I think the library has a page. If someone could put it in the chat, I'm sure you can find it on the NYU website if you look at libraries, that describes how the libraries are going to function. But yes, for the purposes of instruction, the library is open and functional.
Perfect. Any closing thoughts, Rich, Carlos, Mel, Clay, Matthew?
I just thought I would direct everybody to Clay Shirky and a large team of instructional technologists have been working really hard to answer a lot of the questions that are in the chat regarding just how to manage the challenge of teaching for 1.5 to 2 hours with face masks on, for example. You know, how to take a break, how to deal with the fact that you used to have students work in groups and now we can't have students working in groups. Just to make sure that everybody understands that all instructors do need to wear their face masks for the entire portion of their instructional time. And that may mean having to really think differently about how you structure your time so that everybody can get a chance to take a break, et cetera. So just know that those resources are available through your units and schools, and Clay has made a lot of really tremendous effort to get that kind of support to all instructors on how to teach in this new context.
Great, thank you. Anyone else? Any closing thoughts?
Just thanks to everybody for all that they're doing and all the hard work everyone's putting into this. And we are all fully aware how difficult and suboptimal it is, and just appreciative of everyone's efforts.
Great. Now we'll reiterate that as we close, and simply saying that we are all in this together, and we'll look forward to getting through this in the best way possible and providing the best academic experience for our students that we can. So I want to thank all of my colleagues here on this webinar. I want to thank all of you who were able to log on. I want to remind you that the webinar, the recording, will be posted on the NYU Returns website so that anyone who missed it can view it, and you should feel free to share it with your colleagues. And I encourage you to take a moment to check out previous webinars also that have been posted about public health, about many other topics that provide lots of useful information. Please continue to check NYU Returns, excuse me, for the most up-to-date information about the fall 2020 semester. And with that, we will close and say, stay safe, enjoy the rest of your summer. We look forward to seeing you in the fall. Take care.